Hello dear patients, today we are going to review the case of wine-colored spots on glans penis. A man came to us, he had excessive weight and he had spots that you can see on the picture. They were there for about 1.5 to 2 months. At first he didn't pay attention at it, then he went to dermatovenerologic dispensary where he was set our favorite diagnosis of candidosis. Clotrimazol cream was prescribed. It didn't help, it only got worse from it. It also got worse after taking wine and some alcohol drinks, he noted it himself. Then ointment was changed to nizoral cream in the same dermatovenerologic dispensary. Again it didn't improve, it only got worse gradually. Then ointment was changed to hormonal ointment by type of triderm. For some time it improved, then it got worse again, then he was told that they didn't know what it was, and he came to us after getting tired of visiting these doctors. First of all ointments were cancelled, for 4 or 5 days at least, which is done before taking any analysis. Then analyses for candida were taken. I'll remind you that this is 8 candida fungi. This is touch smear from the surface of glans penis. This is culture test for candida, culture test for bacteria. In parallel, analyses were taken from the surface of rashes and from inside the canal for infections. However, all was within normal. Then analyses for allergy were taken. This is blood for immunoglobulin E, circulating immune complex, etc. As a result of that, a sharp increase of circulating immune complexes was found, immunoglobulin E and eosinophiles. This indicated an allergic reaction on glans penis at the present moment. No antifungal medications should be used in this case. The patient was consulted by allergologist with determining of food intolerance and other allergic analyses. We are not going to intellectualize and talk about it now. After such examination, we prescribed sodium thiosulfate, calcium gluconate, antihistamine medications, compresses, pastes, etc. As a result of that, allergologist also prescribed an exclusion of food products, etc. Again, we are not going to get into details of that, as this is very individual and particular for this patient. In parallel, some immune medications were prescribed. As a result of that, spots gradually resolved. It's no doubt that strategically, if this allergic reaction is not interrupted completely, then for this patient it's advisable to do circumcision. You can watch a separate video about what it is on our channel. Strategically, if a diagnosis of candidosis or other infection is said to you, then it certainly has to be excluded. Otherwise, it's not the cause of lubricating these spots by some creams and making this process chronic. If there are any rashes in the area of sexual organs and for examination and treatment, you can consult dermatologists and venerologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes.